Welcome to the 2020 PDA Pharmacopeia Conference. I am thrilled to introduce our speaker and co-chair, Mark Wiggins, owner and Compendial Consultant, Global Pharmacopoeia Solutions LLC. Welcome.
Welcome to the 2020 PDA Pharmacopeia Conference. Thank you for joining us for these pre-recorded sessions, which will set the stage for the rest of the conference. My name is Mark Wiggins, and I am the owner and the Compendial Consultant with Global Pharmacopeia Solutions LLC, and was formerly the Director of Compendial Affairs at Merck. I am also one of the co-chairs of this conference, along with Kevin Moore, Senior Manager of Pharmacopoeia Collaboration with the United States Pharmacopeia. Kevin and I first want to thank the Program Planning Committee for all their hard work in turning this in-person conference into a virtual event. It was not an easy task and took a lot of hard work, but this group did a fantastic job pulling it off. We're really excited about the content that has been put together and look forward to sharing it with all of you. Over the course of these pre-recorded sessions and the three-day conference, we'll be hearing from speakers from industry, from the world pharmacopoeias, and from regulators on a wide range of topics that explore the role of pharmacopoeias in responding to public health crises. There will be sessions on global harmonization of pharmacopoeias in a post-pandemic world, maintaining the drug supply chain, and developing new treatments. We have a mixture of both presentations and roundtable discussions with audience participation. Having participated myself in the previous two PDA Pharmacopeia conferences, as well as many other meetings where compendial topics were discussed, I can tell you that this conference will be unlike any previous Pharmacopeia conference. I'd like to take a few moments to provide you with some background to help in understanding just how we got here. In the Good Pharmacopoeia Practices Guideline, which was published by the World Health Organization a couple of years ago, in collaboration and partnership with many of the world pharmacopoeias, they provide information on the purpose and the significance of pharmacopoeias and describe a pharmacopoeia's core mission as being to protect public health by creating and making available public standards to help ensure the quality of medicines. Pharmacopoeia standards support regulatory authorities and reflect the specifications approved by the regulatory body. But the document also points out that today there are as many as 49 pharmacopoeias in the world, with differences between these pharmacopoeias. And I put 49 in parentheses because since the publication of the Good Pharmacopoeia Practices, the number of pharmacopoeias has actually increased, and there are now as many as 60 pharmacopoeias in the world. But when we look at the history of the pharmacopoeias, it's clear to me that harmonization or convergence of standards has always been at the heart of the development of the pharmacopoeia. The United States Pharmacopeia, which was first developed in 1820, so celebrating their 200th anniversary this year, was established when 11 physicians came together representing the 22 states that were then in existence, trying to harmonize the standards of quality for the medicines that existed in those states at the time. The British Pharmacopoeia in 1858 merged the content of the London, the Edinburgh, and the Dublin pharmacopoeias which existed to create this British Pharmacopoeia. Again, a standardization or harmonization of the standards. And then fast forward 100 years or so, and the European Pharmacopoeia in 1964 was created when 8 member states of the Council of Europe came together and established the European Pharmacopoeia Convention. The number of member states has now increased to 39, which includes the United Kingdom plus the European Union and 30 observers from all over the world. But the idea of creating a worldwide unified pharmacopoeia really goes back even as early as 1874 and was culminated in the publication in 1947 of the International Pharmacopoeia by the World Health Organization. When we broaden our scope in the history of pharmacopoeias, we see many other of the important pharmacopoeias listed on this slide. The Japanese Pharmacopoeia, for example, was created in 1886, and the JP, along with the USP and EP, are the pharmacopoeia discussion group members focusing on harmonizing the standards for several excipient monographs and general chapters between those 3 pharmacopoeias. But there are several other pharmacopoeias that are of note here. All of these are important, but we see the Chinese Pharmacopoeia and the pharmacopoeias in Russia, India, Korea, Brazil. And we recognize that even on the far right of the timeline, that the efforts to develop regional pharmacopoeias is continuing even today, with the establishment of the Eurasian Economic Union Pharmacopoeia and the Mercosur Pharmacopoeia, both underway. So with this history and background in mind, when we first started talking about this conference, we were taking what I guess I would consider a fairly traditional approach and proposed the title, The Pharmacopoeia in Drug Quality, Past, Present, and Future, trying to look at what has happened before, where we are today, and where we might go. But everything changed when the pandemic came along for COVID-19, and that forced a rethinking of the conference as well, resulting in the final title, The Pharmacopoeial Role in Responding to Public Health Crises. Within this conference over the next several days, in addition to this pre-recorded session to set the stage, there'll be a session on the role of the pharmacopoeia and standards in maintaining drug supply during the pandemic, as well as in developing new treatments. The final day will have two roundtable discussions, one talking about communication and the other trying to draw conclusions about what we've learned and where we go from here. Throughout it all, as was mentioned earlier, we'll see presenters from the pharmacopoeia around the world, the regulators, and the industry. So there'll be a wide range of speakers to represent the information and engage with you. I mentioned the planning committee earlier, and I wanted to give credit to the individual members on this slide. The industry representatives shown on the left and the pharmacopoeia representatives shown on the right, with two key members of the PDA team shown at the bottom, Annette Bacchus and Ruth Miller, who've been very helpful in keeping us on track and moving along to reach this point in the conference. So what's in store in these pre-recorded sessions? It really is again intended to set the stage for the conference. After my remarks, you'll hear a presentation from Marilyn Stebbins from the UC San Francisco School of Pharmacy, who will describe her own personal journey as a COVID-19 survivor. Following Marilyn, there'll be a presentation from Pam Traxel of the American Cancer Society Cancer Action Network, presenting some very interesting information and data on the patient's perspective of healthcare during the pandemic. And finally, my co-chair will provide some closing remarks and lead into the first day of the live session. With that, I'd like to again thank you for joining us for this conference, and we look forward to sharing and engaging with you over the next few days as we explore the role of the pharmacopoeias in the public health crises. Thank you.
Thank you so much, Mark. I hope everyone enjoyed today's presentation. We look forward to having you join us live on Tuesday, September 29. Thank you.